Let's talk about the A spot, the C spot. I'm going to give these in alphabetical order. G spot, N spot, the P spot, and we've also got this F spot and U spot. The A spot. This is our anterior fornix orgasm or area. Inside of the vagina, so this will be in a female-bodied individual, we have our vaginal canal, and towards the back of the vaginal canal we'll eventually get to the cervix, which is the entry into the uterus. But just north, or just the anterior area of the cervix, between the bladder and the cervix, you'll find this small fornix area, the anterior fornix, where there's a cluster of nerve endings that are actually, for a number of women, quite sensitive and quite orgasmic. So when you think of your classic G-spot stimulation, 1 to 2 inches inside of the vagina and up north if they're laying down, this would be about 5 to 6 inches inside up north while they're laying down. Another area for people to explore for pleasure. Now, there's differences in people's bodies. Some people, when there's any type of toy or a penis near that, if they're hitting the cervix, that can be very uncomfortable, but then other people might enjoy that. So again, it's about exploration, about using a long G-spot toy and inserting it all the way inside to really find if that anterior fornix feels good for you. The C-spot. The C-spot. Any guesses as to what the C-spot is? And it's not clitoris. And I'm actually out of toys, so if you don't want to participate anymore, I understand. I gave them all away.
Cervix.
Cervix. That's a really good... That could be the C-spot, not for our purposes, but cervix can be a pleasure zone for some people, although a lot of people who've experienced, let's say, pelvic exams and pap smears might say, ouch, from what I hear. It's actually an eargasm. And the reason why it's not called an E-spot is only because of the shape of the C here. What a number of people have reported is that with sensory stimulation of the ear, whether it's the earlobes or around the inside or even internally, that there is a pleasure aspect to that, a sensory experience that makes people either cringe, have like chills or shivers, even lubrication experiences. Some people have even reached orgasm that way. Now, we sometimes associate some of these unique orgasms with people who may have experienced spinal cord injuries, but this can also be for anybody. A number of people will say that they do experience these during sex, or it can even trigger other types of orgasms. Like when we reach like a clitoral plateau in our orgasm, where it's difficult to reach that orgasm, sometimes the addition of that combo, some other area, can actually send somebody over to the next level. G-spot, I think a lot of you are familiar with the G-spot, the old Grafenberg orgasm. Beverly Whipple and John Perry named it a G-spot after Ernest Grafenberg. So our G-spot, I think a lot of you are familiar with, internal inside of the vagina, about 1 to 2 inches interior or up north, with intense pressure, can also lead to orgasm and or ejaculation. The N spot, any guesses?
Nipple?
Nipple, well, we talked about nipple. Nipple and breast were kind of, I heard neck. You may not get this one. So, oh, someone did say it. That's great, someone said the nose. You're thinking to yourself, what? There's a nosegasm? Well, some Chinese researchers about 4 years ago did a study where they were exploring some area of sensitivity within the right nostril, and they found that just under 5% of people, when it was stimulated, actually produced an orgasmic response. Now, does that mean we're all going to try it when we go home tonight? Maybe not, but we all want to come out with some unique information out of here, right? So there are people that can nosegasm. P-spot, we did talk about the prostate, so and that was in a previous lecture, so we won't talk too much about that, but for some men who are brave enough to allow some type of internal stimulation of the prostate, they may experience some intense orgasms through that type of prostate play, with or without any type of penile sensation or stimulation. So that means that you can have nothing touching the penis, only stimulating the prostate, and you may be able to reach that orgasm or that ejaculation. It's a pretty powerful experience, and when a male or a prostate owner has described it, typically they will describe it as something very similar to what internal orgasms from women have described, which is something that erupts from the inside of their bodies, down back near the uterus or down back near their prostate, and it's something that sort of comes in rhythmic like waves. So it's really a unique way for us to experience an orgasm with no touch at all when it comes to our penis, which is something that a lot of people have associated it to. Reach orgasm, it must be associated with a penis going inside of a vagina and this in and out thrusting, which is not the case, because we can do these things without that PV intercourse. The U spot. Any guesses as to the U?
Urethra.
Urethra, yeah, good job. I gave you a choice, you got it. The urethral orgasm. Here's an area where we don't always associate pleasure with. We typically think our urethra is there for us to expel urine, but it has a pleasure possibilities as well too if we explore it. Think of getting one of the most pointed vibrating dildo or vibrator, and imagine putting it right on the tip of that urethral opening and allowing the waves of vibration going all the way inside. It's a direct track into our internal genitalia. For a lot of people, it can stimulate the bladder, it can stimulate the anterior pharynx within, it can even stimulate the clitoral legs, the crura, the roots of the clitoris, and also the internal nerve endings, places that we don't always have an opportunity for us to stimulate. People have been known to have even orgasms to where that's even triggered female ejaculation as well. Yes?
Could that result in urinating?
Could it result in urinating? It's possible, but typically our body sort of have mechanisms that shuts off and opens up our different functionalities and valves, whether it's ejaculation or urination, when we're experiencing pleasure. So it's very uncommon, and that might even be a sign that someone might have weak valves or some type of vascular need for Kegel exercise or pelvic floor work. But for most people, it won't be a problem. Good question. The F spot. Foot. Oh, that's a great one. What I love about this is that we're all sort of seeing these letters and thinking there are a lot of possibilities. And yes, we can have footgasms. If we really wanted to get creative, we can put S spots for spanking-gasms, because there's a lot of people I've seen at dungeons that get off on a spank or some type of sex play. There's even electricity orgasms where people actually experience electrical play, whether it's with the violet wand or other I know this sounds a little wild, but like stun gun play, where people just gently sort of graze a person with the stun gun, and that intense electricity actually triggers orgasm. So somebody likes that. It happens, folks. It happens. For our purposes, it's not a foot job. It's not going to be about electricity. It's actually about the frenulum, the area of the penis that for circumcised individuals is the most sensitive, and for individuals who are uncircumcised, outside of the foreskin, it's also an area of pleasure. The frenulum orgasm. So if anybody here was here for Dr. Ava's presentation beforehand, you heard a bit about the Pulse 2 from Hot Octopus. If you have not, I would encourage you to go to their booth, which is right outside. They're going to raffle off one of these products to anybody who comes up and asks them 2 questions after this presentation. Just say, tell me about the product, and how much is it? There's 2 questions for you. But here's what the product does. There's an oscillating area, and oscillating is a type of vibration. It sort of has a fast circular rotation, and the penis is placed inside of there. Now it can be a product that can also pleasure a flaccid penis, and people can reach orgasm or ejaculation from a flaccid state. So this is also a wonderful product for anybody who's managing ED. But that can be our frenulum orgasm. Oh, I'm sorry. The frenulum is if you take a penis. Imagine if this was my penis, and imagine you flipped it upwards. It would be on the underneath portion at the intersection of the shaft, the head, and the corona, the ridge that goes around. So it's kind of that freeway system where everything merges. But on the underneath portion, it's the most sensitive area of circumcised men because it's the last remnants or area of the foreskin that's left from circumcision. So I do encourage you to check that product out as well. Actually, you know what? I'll give you a little story about me trying it out, because sometimes I try out sex toys for products. I use this product. I try it out. I'm used to the up and down motion. I'm used to the intercourse. I'm used to hand jobs, blow jobs, whatever it may be. But it's usually had that stroking up and down mechanism. So this was kind of frustrating. It's like, okay, I'll leave it there, and it's vibrating, vibrating. Okay, a couple minutes went by, and I was thinking, all right, it's not bad, And then all of a sudden there was this point of plateau I hit where I was like, whoa, that's kind of cool. That's a little unique. And it took about 15 to 17 minutes before, as things were building up very slowly, and I got to that point where all of a sudden I started feeling these like contractions. So I couldn't stay flaccid. I couldn't. There was no chance. So I became erect inside of it, and I noticed these sort of pre-orgasmic sort of jumps of my penis where things were getting really sensitive. Eventually, about 20 minutes into using this product, there was that ejaculation that was so unique. It was, I rate it as kind of like the first orgasm you ever had. You're like, you still remember it. It's like in your peak erotic experiences, you're like, wow, I'll never forget that. I was 12 years old in the bathroom, whatever it was. It's kind of like that. You know, it's something that was so unique and so slow building that was very unique for me that it's something that stuck with me. So, and I don't get paid by these companies. I'm just here for your own pleasure. But it's a good product. So the C and the N spot. Your homework is to try this out at home. Also, just to give you a little more visual of the A, G, and U spot, so our anterior fornix area, here's our vaginal canal. Here's our cervix, which goes into the uterus, the opening. And here's our posterior fornix. So this is the underneath portion, the bottom, if a person's laying on their back. And here is our anterior fornix, this area. Notice too that it's very close to the bladder. Also too, our G spot would be about here. There's a lot of talk about this periurethral sponge that has a connection of neural pathways. So our clitoris could be connected to our G spot, could be connected to our A spot, which could be connected to, you know, obviously our different nerve systems, whether it's pudendal nerve system, vagus nerve system, and so on. So there's our G spot, we know, about 2 inches in. Our U spot, here's our urethral tract, which can also be stimulated for people to also experience orgasm. Our P spot, this would be for individuals with a prostate. And then our F spot, here's that underneath portion that we're talking about of the penis. And by the way, don't treat your foreskin like that. If you are encountering penises that have foreskin, it's a little aggressive, I'm not going to lie to you. But you can gently play with it and stroke it, but that's just uncalled for, right? So I want to thank everybody for attending. We're going to have some questions in a moment, but I also want to call out my partner, my mentor, and Dr. Ava Cadell, because the two of us, we wrote this presentation together. We did this in Los Angeles for the She Expo in January, and you know, we weren't able to do it this time together, but we do love to work together. I also want to thank Zorro, which is Ava's cat. The reason why is that every time we stuck something inside of those little dolls, I kid you not, this little sort of smelling, sniffing, licking, I think Zorro wanted to explore his unique orgasms as well too.